Talking about sensitivity, Dr. Norma, is there any age bracket that you see are coming with this condition or specific gender? Let's say women has more sensitivity than men, or this certain age has more sensitivity than men, or coming up with teeth whitening problems?
Sensitivity, usually it comes more with people who have high intake of acidic foods, also who brush very hard and lose some tooth surface structure due to the brushing. Also with age, the sensitivity usually becomes a little bit more because of the gum recession that happens with the aging process. So usually if the sensitivity is very high, we don't directly go with whitening. We start by treating the sensitivity by desensitizing agents or specific toothpaste that will decrease the sensitivity. Then only we can proceed to the whitening process.
Thank you, Dr. Norma. When it is not recommended to go for teeth whitening, is there a certain phase, is there a certain age, is there a certain reason for not going for teeth whitening?
It's not recommended to go for teeth whitening if you're pregnant, if you're breastfeeding, or in patients with age less than 18 years old. In these categories, usually scaling and polishing is more than enough. Also, it's not advisable to undergo whitening if you have anterior fillings, anterior veneers or crowns, because the whitening material will only whiten the normal tooth surface. It will not whiten the prosthetic part. So if you undergo whitening, then you will end up with a color difference between your normal tooth surface and the prosthesis. So as a result, we might have to change the dental artwork that the already patient has only to match the new teeth color. And also, if the patient is not happy about the size and the shape of the teeth, we do not recommend teeth whitening, because the teeth whitening is only to get a brighter teeth, but it will look the same. So if the problem is more than that, then we will advise the patient to consider doing veneers or crowns to resolve the problem that he has.
Dr. Norma, I know earlier you already mentioned the procedure of teeth whitening. You start with scaling and polishing and then go towards teeth whitening. How long does this procedure take?
Usually the scaling and polishing is around half an hour. And we check on that visit the condition of the gum. If the gum is healthy, if there is no bleeding, we can proceed with the whitening. That will take between 40 minutes and 1 hour. But if the gum condition was not very good and if the gum was bleeding, then we will definitely postpone the whitening appointment to 1 or 2 weeks later. We will recommend the patient to use a mouthwash. We will give him oral hygiene instructions, and if he was strict with them and if the gum condition was improved, then only we can go for the whitening procedure.
Right. Dr. Norma, talking about the health of the teeth, there is a lot of misconception also associated with scaling and polishing.
Yes.
Do you think scaling and polishing also has some side effect, or it is actually to keep the health of your teeth?
Scaling and polishing is very important. It should be done every 6 months, and in some patients even we recommend it every 3 months. So the procedure itself, it's removing all the debris or from food, bacteria, calculus that has deposited on your teeth. These deposits, if it stay in your mouth, then they will be the cause of the caries, of the gum problems, and any oral problems that will happen later on. So we have to remove it. The polish, we recommend it twice a year because the polishing, it's abrasive procedure. It's very minimal abrasion. So it should be done usually twice a year, only not more than that.
Thank you so much, Dr. Norma and Dr. Zainab, for joining us today. It was indeed a very interesting session with both of you. And I hope people and viewers out there have actually listened to what the doctors have prescribed and suggested in terms of keeping the oral hygiene. Thank you so much once again for joining us today.
Thank you. Thank you.
Thank you for watching our today's episode. We'll be back again tomorrow at 2 p.m. with Outline Your Way. Keep watching TTV.